Hello, my friends. I'm Dr. Allen, CEO of Travel Meds to Go. Today's medical minute is a continuation of malaria prevention. Yesterday, we learned that if you're traveling to Africa, Asia, South or Central America, parts of Eastern Europe, parts of the Caribbean, and parts of the South Pacific, you need malaria prevention medication. Today, we're going to talk about the four main types of medications that are being used, and these are the ones that I use in my clinic. And the first medication is Malaria. This is my favorite one because it has very few side effects. You start it 1 to 2 days before your trip. You continue daily during your trip and continue for an additional 7 days after your trip. The problem with Malaria is that it tends to be more expensive. You can't take it if you're pregnant or breastfeeding, and you can't take it if you have very bad kidney disease. The second medication that I use is called mefloquine, and mefloquine I don't like as much because it has more side effects. However, you can use it if you're pregnant or breastfeeding. You start 1 to 2 weeks before the trip. You continue weekly during the trip, once a week, and for 4 weeks after the trip. The other problem with mefloquine is you can't take it if you have a seizure disorder. You can't take it if you have certain psychiatric disorders such as psychosis, and you can't take it if you have certain heart problems. The third medication that I prescribe is doxycycline. Doxycycline is an antibiotic. You start it 1 to 2 days before the trip. You take it daily during the trip and for an additional 4 weeks after the trip. The problem with doxycycline is, one, you can't take it if you're pregnant or breastfeeding. Two, if you're prone to sunburn, then it increases your risk of sunburn. So if you're traveling in places with high sun exposure, then that may not be the best medication for you. The second problem is that if you're a female and you're prone to yeast infections when you take antibiotics, then you're probably going to get a yeast infection with this medication. But don't worry, we prescribe medication for that as well. And then the final medication, which I don't like as well, but it does have some benefits, is called chloroquine. Chloroquine is very similar to mefloquine, meaning that you start 1 to 2 weeks before traveling. You take it once a week during travel and for 4 weeks after travel. Chloroquine can be taken during pregnancy and while breastfeeding. The problem is there's resistance to it in almost every place except for parts of the Caribbean. So there you have it, the 4 medications that I prescribe for malaria prevention. Safe travels. Visit us at travelmeds2go.com for all of your pre-travel medication prescriptions, and don't forget to like and follow us.